latest edition of Health Talk, which comes every Saturday. Now, if you've been following this show, I think we've been discussing a number of critical issues, that is medical issues. And today we thought we discuss another critical issue that might affect you in our community. And today we are discussing understanding stroke. Stroke stroke. So what is this that we are talking about today? So my guest from Mandora Teaching Hospital is Dr. Mulenga Chilando, and he will help us understand what stroke is, considering that it is not only in Zambia, it affects people globally. So we would want to know what steps we should take to prevent this particular condition. Doctor, good morning. How are you feeling this Saturday?
I'm feeling fine. Thank you so much. Thank you for having me on this show.
Okay.
All right. And good morning to the listeners and viewers.
Okay, nice one. I'm your host. My name is Lamek Zulu, but at home you know me as Four Legs. So let's begin, Doc. Let's talk about the basics of stroke. How do you establish it from the medical point of view?
So maybe I can start with defining stroke. So stroke generally is an interruption in blood supply to the brain. Huh? Yeah, so when you have an interruption of blood supply, it could be the blood vessel being clogged or a rupture of a blood vessel.
Okay.
I mean, or that's what will bring up a stroke, basically. And, once you have that, you may have the different symptoms. People will tell you, someone has weakness one side, and so those are things that you generally get with strokes. Yes.
No, okay. Having said that, educate us about the causes.
So the causes of stroke, the commonest cause is high blood pressure. So poorly controlled high blood pressure will cause strokes. That's the commonest one. But we also have things like diabetes, which has become quite common in our population. And of course, obesity. We've seen people are gaining a lot of weight. These things. So people are generally become obese. We've seen young people also getting such things, as well as smoking, alcohol. Those are also risk factors for stroke. Cocaine, those who take drugs like those, that's also increased risk of stroke. Yes.
Do we have any different type, or we just have a single type of a stroke?
So the stroke, like I had mentioned, because it's a blockage of a blood supply, like interruption of blood supply, right? So it can be. So the two types are ischemic stroke. Ischemic stroke is where you have the blood vessel being blocked. So when a blood clot, then you have a stroke in that area of the brain which is not being supplied by blood. That's an ischemic stroke. That's the commonest one. Then we also have a hemorrhagic stroke in which a blood vessel ruptures. So in that case, and then blood flows into the brain, and then you have, that's also the other type of stroke. It's less common, but in our setting, of course, it's also relatively quite common because high blood pressure is very common in Zambia. Yes.
Okay. I mean, you've already labored to explain to us who is at risk. Obviously, you did mention that somebody with diabetes.
Yes.
Somebody with high blood pressure.
Yes.
Among other things, obese. Now, how do I identify the symptoms? Are there warning signs that this particular individual might suffer from stroke?
Yes, they are. That's actually an important thing. So yes, there are warning signs. So some people will present with weakness on one side of the body, maybe facial droop, weakness in the arm and leg on one side, or maybe they're unable to speak, or they're unable to swallow, or they have dizziness. Those are some of the things that you get when you immediately and it comes suddenly. So first we know then all of a sudden that's a warning sign. Sometimes it may disappear in some people. But even if it disappears, it doesn't mean that you are fine. You have to go to the hospital and get checked. So that's a warning sign for a stroke. Yes.
Okay. Now, in medical terms, there's what we hear, the phrase, time is brain. So why time? And why is it a critical factor?
Yes, so that is actually a mantra that we should keep. So with strokes, when we talk about interruption of a blood supply, once my brain, it means that part of the brain would die. But if you take the or let's say when they have a stroke, though you can do something. There's certain things that we can do in the hospital that of course you can't do at home. So the earlier you take them to the hospital, the better for the better the outcome, because the stroke is a devastating condition. That's a fake life, Imagine you're working, you're the one providing for the house, and all of a sudden now you can't
yeah,
walk,
economically,
yes. So it will affect a lot of, even the people around you will be affected. So the earlier you come to the hospital, the better. The more you can do more when you come early. Yes.
Okay, so now suppose somebody suddenly develops a stroke. Are there any first aid things that can be done to that person just to help them before they get to the hospital?
Yes, so one of the things we encourage, of course, first of all, the first thing you do is we don't want you to give them any drinks or any food once they've had that, because when they have weakness in the arms, they also have weakness on the throat, they can't swallow properly. So you don't give them any food or any drinks. We want you to sit them up, raise their head, so that because sometimes you have increased pressure when you have a stroke, whether it's ischemic or hemorrhagic. Hemorrhagic, of course, because there's a bleed there. So more about pressure on brain, and if you raise the head, at least you reduce the pressure a bit. Even if it's ischemic, there's swelling in the brain. So you have to sit them up a bit, or at least at an angle. And then if they're having feet, sometimes the stroke mock feeding, or you lay them on the side so that they shouldn't aspirate. Because that will cause pneumonia, to make even the treatment of the stroke very difficult for us. So some of the things you want to, maybe you can lay them on the side if they're having difficulty swallowing and you think that they're choking and so on, you can lay them on the side and bring them to the hospital as soon as possible, because the rest of the management still will be ours.
The rest of the management. So in terms of, talk to us about the treatment options.
So treatment options, you come in early. Once you come in early, because there are two types of strokes. Right? There's a ischemic stroke where we have a clot in the brain. So that one, what we do is if you come in early, like in the first 3 to 4 hours, we do a CT scan immediately to confirm what kind of stroke it is. So we have an emergency team at Ndola Teaching Hospital that will do those investigations. We do a CT scan, and then once we establish it's an ischemic stroke, we can give certain medications. This is what we refer to as TPS. So this medication, when we give it to you, it will help dissolve the clot. And so you find that completely, maybe after a couple of hours. So if you come in early, we can do something like that. Of course, other options that are there, even physically removing the clot, but that we haven't reached that stage in Zambia of doing that. We're hoping in the next couple of years we'll be able to do that. That's for ischemic strokes. For hemorrhagic strokes, usually it's just a matter of, for both of them, of course, we want to control blood pressure, but there's a slight difference. Hemorrhagic stroke, we want to just make sure the blood pressure is normal, because brain. So for that one, we want to make sure control the blood pressure so it doesn't expand. It doesn't become worse. Yes, so those are some of the things that we do. That's acutely. But of course, the other things we can do in long term. So acutely, we want to make sure that we stabilize the patient doesn't get worse. And if they're not able to swallow, we usually put a tube to feed them. Yes, because when you have weakness, you also have the same weakness. You have the same weakness on the throat. So normally when you're swallowing, your throat, your muscles, when you start swallowing, your airway is closed then. But it's like but then when you have a stroke, you find that you're not able to close that properly. So when you're feeding, some of the food is going into the lungs, and the patient develops a pneumonia. And that's one of the things that kills our stroke patients the most. It's probably like the commonest cause of death. So some of the things we do.
Okay, so in terms of practical steps, what should we do just to reduce the risk factors? Okay. I know you did mention in Chamba, people with diabetes, for example, people with hypertension, yes, alcohol consumption, maybe just on those and others that you feel.
Oh, yeah. I think one other thing I forgot to mention is also sickle cell, right? Sickle cell is actually a risk for stroke. So you find most young patients, most sickle cell patients would even have a stroke as age 10 or even younger. So that's another risk factor. So how you would prevent mass strokes? Of course, for those that are hypertensive, but if you're already normal, you know that guys, it's a silent killer.
It's a silent killer.
So that which what but then your blood pressure is raised. So you want to be taking medication and you have normal blood pressure. So even when it's normal, you don't stop taking your medicine. You keep on taking it. Other things you do, of course, the diabetes, you use the medication, but lifestyle changes as well. I want to know actually people were exercising. Now it's like people have gained. You find that 10-year-old who's
quite
more
big.
Than that. So those ones are at risk of having strokes eventually. So you want to encourage people to exercise, eat healthy, right? Of course, you can have maybe hungry lion once in a while, but that's something that you should be doing every day, right? Burgers and so on. Better you have more fruits, more vegetables, and also exercise. So we need people to be exercising. People don't walk. But it's better that if you come home, you walk to the shops to buy something. That should help. So usually we advocate like some sort of exercise, walking, like enough hours of exercise, even strength training. Those are things that will help you prevent mass strokes. Yes.
So what about those that have survived the stroke? There are people that I know that had this stroke, but are there certain things they need to keep doing?
Okay, that's a good question. So for those that have survived stroke, usually what we do for them is we have rehabilitation. So of course in most of our hospitals we don't really have like post-stroke proper post-stroke rehabilitation, but at least we're able to do physiotherapy. Occupational therapy is something that we're supposed to be doing. Physiotherapy, even that will help, because once you start gaining back strength in the first couple of months, you may not have. So stroke rehabilitation takes long. You're taking your time just to get back your strength will take time. So we do physiotherapy as one of the things that we're able to provide at the hospital. So you sort of do some stretching movements, try and keep the arms and the legs that are weak moving, so that once they start gaining back strength, they're able to move those. Because if you don't do physiotherapy, those will become stiff. So even when the strength comes in, but if you other things we do, of course, things like so speech therapy. We don't really have speech therapists in our setting here, but we do have like a few in the country. That's one of the things that we are looking forward to having as well. But we've had speech therapists advise us on how to test swallowing and so on. So there's certain exercises to try and help people improve on swallowing and speaking, that we also try and institute in these patients. And also the stroke, because of how serious it is, depressed and so on. So we need to involve psychiatrists. Of course, for us, mental health is something that hasn't been something we've paid so much attention to in Zambia, but it's something that we're also now looking at as something that is important in these patients, right? So that's one of the other things that we need to put up in rehabilitating those survivors.
Okay. Now, I know that, like we said from the beginning, that this was a breadwinner. They go through this condition, stroke. Now, as a family, what type of support should we, give to this particular patient so that we help them recover quickly and obviously they get back to their normal self?
Okay, so here in Zambia, because like I mentioned, we don't have so many rehabilitation centers, right? Like in other countries. So the caregiver, the relatives are the rehabilitation centers. Everybody rehabilitate. So everybody they have to, of course, take up some of the roles, taking care of their relative, feeding, dressing. Some of them are not able to do that, and also no place to stress. Sometimes physiotherapy. Sometimes we do it only 2 to 3 times a week, but they will have to take up some of those other activities. And speaking to them, because people get depressed, right? But if you're getting support from the family, they'll generally do much, much better. Recovery, of course, in younger patients is better than in older patients, but it's also dependent on other things that are involved. You might get depression because maybe the relatives it will bring a bad outcome. So caregivers are the most important very important in recovery of these survivors.
So let's talk about this particular survivor. What's the journey for them? Like from my layman's knowledge, I hear bafidibade sheta ko babogam,
Okay.
such things. But from the professional point of view, give us the journey. How is it?
Yeah, so you want them to start immediately. So immediately after, once they've already become stable, we want them to be out of bed, even when they don't really have, they can come on the chair, not spending so much time on bed. We want them to be as active as possible. We encourage people to live from bed but even those ones who are very weak, we encourage the family, the caregivers, because we kind of bed, they'll develop muscles, pneumonia, those things that we worry about. And in the first 3 to 6 months, that's when they make the most recovery. So that's the time that we want them to do a lot of physiotherapy, a lot of all these other things, so that in that period they make the most gains. Because beyond the year, people don't really improve so much beyond the year. So in the first year, you want to do as much as possible. And beyond that, you still continue, but at least they would have recovered most of the function by that time. So if you have to be as aggressive with rehabilitation as possible, once someone has had a stroke in the first period. And the people have to be patient, of course. They have to understand, take over to the lower quarter stroke to amber physiotherapy, week, next week, it's something that will take some time. It's a gradual thing, but it will eventually, we've seen some of them recover almost completely, others, so it just also depends on the individual. But
Okay.
yes, they do improve.
I know that there are certain days that people commemorate in the health sector.
Yes.
Do we have a specific day for that doctors, nurses, or medical personnel commemorate stroke day just to give our awareness to the community?
So we do have a World Stroke Day. Well, the actual date I'm trying to remember, I think it should be in October. Let me confirm before I lie. But yeah, there's a World Stroke Day. So we even have a World Stroke Organization, which I'm also a member of, and some of our health practitioners here are also a member of, and we have meetings yearly to see how we're doing. And generally, stroke has been a major, it was the highest cause of death in 2022, 2023 here in Zambia. And now, because we've instituted things like stroke units in most of our institutions, even here at Ndola Teaching Hospital, we've found that now mortalities have sort of reduced. So about the World Stroke Day, it's actually in October, like I said, but on the 29th of October. I was trying to remember. I think it was in October, because that's when usually we have our meetings as well.
So what message do you have for the community in terms of awareness?
Okay, so one of the things, of course, you should know about strokes is that even when someone has what looks like a stroke and then they improve immediately, it doesn't mean that it's something that you should worry about. That they should come to the hospital even after they've improved, because that is a warning sign for a stroke. Because sometimes people have those stroke symptoms and they disappear, and then they have another one, and they think immediately you have taking care of yourself, exercise and all those things. And one of the reasons I wanted to come here to discuss stroke is also the fact that we'll be starting doing so thrombolysis, what I was talking about, what we do for strokes, ischemic strokes. That medication we generally didn't, but we're having that now. Ministry of Health sort of helping us have those things, so we'll be able to perform those. So we want people to be coming as early as possible. You have to come in within 3 hours for us to use that medication. Otherwise, if expire per my shelves, yes,
So there's medication now that has been provided.
Yes, so there's medication that we have that we'll be using to remove these clots.
Or these clots,
Yes, for those that have ischemic strokes. So the brain, we can't use those, and it might just cause complications.
So how quick should they come?
So we can only give those drugs to someone who's coming like within 3 hours, 3 to 4 hours.
Is it 3 hours? If you sense the signs that we spoke about?
Yeah, so you just notice that there's weakness. But whatever you notice, you come in within. So the moment you notice those, from the moment you notice it to the time that we should administer that within 3 hours.
Within
3 to 4.5 hours of you having noticed those symptoms. So if you come later than that, we can't use those drugs because then you're not eligible for that. But so obviously to be very helpful, because then people will be able to walk out of the hospital in a few days after having a stroke. So if they're able to come in early, those are some of the things that we will be able to do for some of our patients.
Okay, now let's talk about myths. I know that every disease, so let's talk about some of the common myths that you've encountered in your line of duty.
Yeah, so I think one of the commonest, Zambia being a Christian nation, we know that Varaloa maybe, I don't know, I haven't really, but stroke is because of the way we've been living. Of course, 80% of strokes are preventable. So the wulosh, if you to ikala, if you area, if you salan can if you strokes. So witchcraft is probably a myth for stroke. The other thing is what other myths have I come across? Some of them obviously think that using herbal medication, something that when you go to, herbal medication has its advantages. I'm not saying that everything is wrong, but some of them think that you can go to a herbalist or whatever and then they'll completely heal you of a stroke. So please just come and let us take care of you the way we're supposed to. So you should know that the tattoos and so on will not heal your stroke. Because if you have patients who have tattoo, now so it's more about rehabilitation. Some of those things, I'm sure it's probably still attributed to witchcraft. Those are some of the myths that come with. I don't know any other myths I've come across. I'm not too sure. I think those are the ones that I've come.
Okay. Just before I get to the phone calls, just give us what I would call what we should take home in terms of advice regarding this disease.
Okay.
Those things that you'd want to emphasize on. Your advice to us.
Okay, so about stroke, what we should all know is that this is preventable. Preventable in terms of how we live our lives, what we eat, keeping fit, how we maintain our weight, and so on. All those things will help prevent strokes. And also, we should all know that we should come to the hospital as early as possible. We have treatments that will help improve outcomes with strokes. So people, please make sure you come, bring your patients as early as possible to the hospital. Don't say, okay, to manifesta favala wapabushi kuba leta mwa leta popene ya chitika stroke mwa leta to abamona to aisho fya kukonkanya
+260-212-617140 in case you have a question, comment or contribution, or you just want a clarification, because we have the expert in the studio. It might have been something that you might have encountered as a family or in the community. So kutimwai pusha +260-212-617140. That's the number that will give you access. I have Dr. Mulenga Chilando here who will be able to answer that question. I have a caller on the line. Let's talk to this one. Oliver, good morning. Hello, good morning.
Hello, good morning.
Good morning, thank you. You are through to Sun FM. Who are we talking to?
Speaking to Stanley Mwamba from Luanka.
I just got the Mwamba part. The first name, sir?
Stanley.
Oh, okay, go ahead with your question.
Yes. I just want to find out. So, talking about the master Yalanda, Pakwamba stroke, I think the big one is the position of my potter, the other gentleman, national as the to work because there is also all volume off, volume on sometimes, but the program is that's what person of officer, sorry. But my question is, master is your stroke, Pakwamba, Yalanda fan.
Okay, thank you very much.
And one other thing, before the
Mkwai.
So the Paku will stay away from the program. Now, what the opportunity? Sports with the boys.
Okay, we'll talk to management about that. Thank you very much. Okay. Okay. Now attend to that question. Signs. Emphasize on the signs, symptoms.
Okay, thank you so much. I think I'll just go through the signs again. So when you notice someone's face drooping, like one side, that would be a sign of a stroke. Or that would also be a sign of a stroke. Also, one side of the body, all of a sudden, that's also a sign of a stroke. Another thing that you would have, right side, or that's also be a sign of a stroke. Other things would be someone just becomes dizzy all of a sudden. Balance, that's another sign of a stroke. Yeah, so those are some of the earliest signs of stroke. Or someone is unable to swallow would also be another sign of those. Those would be some of the signs. Some of them even present with headaches. But not fitting, I think, if it's a bleed, because I'm hemorrhagic stroke, so it's about one book sound for a month, one book sound for a month, taking stroke. That would also be one of the signs. I hope I've answered the question.
Yeah, you've actually answered.
Yes.
+2602126174140. That's the number that you can use if you have any question, comment, or contribution on what we are discussing. We're discussing stroke today, obviously, and it's important that you get to learn some of these things so that you are aware. +2602126174140. That's the number that we're using. +2602126174140, so that we learn on this disease. I have another caller on the line. Oliver, let's pick this one. Good morning.
Yes. Good morning.
Good morning. Kindly reduce the volume on your stereo. Is it?
Yes, I'm with you, sir.
Okay. Give us your name, sir.
Yes. Good morning, doctor.
Good morning. How are you?
I'm fine, thank you. You are speaking to Mr. Sakala from Kawe.
Okay, Mr. Sakala, go ahead.
Yes. Yeah, it is quite interesting the way you are just coming out, doctor. Well done. We are listening from you. My question, I wanted to find out. You have said that the patient, when he stroke, you should not be late for the medication which is there for 3 hours. But now my question is that, what about if someone has already hit by stroke? Sometimes by stroke, then the other side is paralyzed. Is that medication going to work if it is brought in time? What time should be brought? Because besides the signs which you have said that it should be, when you have seen the signs, then it's when you can bring the patient. But after the stroke has already struck, because sometimes stroke comes unexpected without signs.
Yes.
Now, at the moment it has been hit him, can he, what time should be brought?
Okay.
Thank you so much.
Thank you very much. Thank you very much. We get the gist. Also, you spoke about the medication that is available at NTH, which is in Dollar Teaching Hospital. So his question is, signs, but can that medication work?
Yes, so it can, provided that they come in as early as possible. That's the reason why we're encouraging people to come in early. So let them come in within the time that we said, regardless of how severe it is. Then we'll assess them and go ahead and see whether if they have an ischemic stroke, then we can give them the TPA. So it will help even if it just hit open yes of a sudden, because strokes are actually just sudden. We don't expect them. For some people, yes, we have signs. But even if it's just hit suddenly, please bring them to the hospital, and we'll go ahead and treat them depending on what kind of stroke they have.
Okay.
Yes.
+2602126174140. That's the number you can use in case you have a question, comment, or contribution. Today we are discussing stroke on Health Talk with Dr. Mulenga Chilando from Mondola Teaching Hospital. So we have an expert in the studio. So this is your chance for you to actually get all the necessary information that you need regarding stroke. +260 212-617140. That's the number that will give you access. +260-212-617140. That's the number. So, Doc, just before we wait for more of our callers, maybe there are certain points that you would want to emphasize on, even on what you've touched on already.
Oh, okay. Yes. So,
okay, hold your thought. I have a caller. Let's talk to this one. Good morning.
Hello, good morning.
Good morning. Thank you. You are through to Sun FM Health Talk. Who are we talking to?
I'm talking to Mr. Vincent Piri.
Okay,
Here in Indora.
Okay, Mr. Piri, quickly give us your comment, contribution, or question.
Matrafa and Jupiter for a doctor.
Mkwa.
A doctor Mwabombashan. Hey, kulaba wabutisho muntunge kapine mulandire hospital. Ero nomba wasango kweba na pako watu bamumone ni after 4 hours. Tena kusicha bashan but is was stroke.
Okay.
Ero kwa mulando wa CT scan. Kulaba kulilipire CT scan nango ni free.
Okay, thank you very much, Mr. Vincent, for that question. So you have two questions, Doctor, because you did emphasize that the type of medication that you have, at least the patient should be brought in 3 hours. Okay, and then 3 to 4.5 hours. So his question or his concern is, wamuleto omuntu within the period, but spoke to a doctor wamuchita attend, beyond that time frame whatsoever.
Okay. So, I'll speak based on what happens at Ndora Teaching Hospital.
Yes.
So, any suspected stroke at our hospital is actually, especially if you come in like within the first couple of hours after having the stroke, those ones actually get a CT done immediately, right? So, our emergency team actually does have those usually actually even get exempted, so they'll probably do a CT without even having to pay anything. So if you come in within that early, so usually the ones that end up paying are those that come in a bit later. If you come in like a day beyond your stroke and so on, those ones will probably have to end up paying for it, because at that point maybe we cannot do so much, or they'll have to do it under NEMA. But if you come in quite early, you find that they'll do a CT immediately. Then maybe those payment issues may come in a bit later, but usually we'll do a CT immediately for those patients and then attend to the patient immediately. And our waiting times in our emergency rooms are actually quite short. You don't really, for strokes, we attend to them immediately. That's the reason why we've had a reduction in our mortality. So we found stroke was the highest cause of death in 2023, but if you look at how it is in 2025 now, we have a reduction because people are attending to them quite quickly. We have rapid response to such things, and we've addressed it. And so, come to the hospital, you won't wait for 4 hours. You'll be seen in a couple of minutes. You come with a stroke.
Yeah. So, and then clarify: do they have to pay for the CT scan?
No. So if you come in early, like I just said, so those that come in early, those ones actually automatically get a CT done. But those that come in a bit later, those ones end up paying. Okay. So if you come, but if you come in quite early, they'll do a CT, because we have to know what kind of stroke it is and we have to address it immediately. But if you come in late to a point where it's just more rehabilitation, then it's not very urgent to get a CT at that point. It's more just trying to, because if you come in a couple of days after a stroke, then there we can still do a CT later to try and figure out what it is, but it may not be as urgent to do a CT as it would be when you just come in early. So those that come in early and you come in just a couple of hours after having, those ones usually just get a CT done. That's just the policy, not just at NTH. I think even UTH does the same thing, and most of the government hospitals that have CT scans.
Okay,
Yes.
Thank you very much. I have another caller. Let's pick this one. Good morning. Hello, good morning. Hello, good morning. Oliver, let's pick this one. Good morning.
Hello.
Yes,
Good morning.
Good morning. You are through to Sun FM Health Talk.
Yes, Doc. With your presenter, I'm back. I'm Mr. Sakala again, Cowboy.
Mr. Sakala, I'm requesting that muweshe ko volume kuchirimba mreumfa nangu ni TV. Lekeni ibe fepa zero.
Okay.
Ibe fepa zero.
Okay, yes.
Ibe fepa zero because we are getting.
How is it?
Okay, now it's okay.
Okay, thanks. Yeah, Doc, come back to you again. Two questions. This medication, sometimes like I didn't heard of medicine of stroke. Is it just been discovered, or when was it discovered? Then the other question is that in Zambia, is it in all hospitals here in Zambia, or it has got maybe specific hospitals which we can find this medicine? And I would urge if it's enough, at least, or even in my rural areas, we should be having such a medicine and specialist doctors like you.
Okay.
Yeah, that's my question, in fact. Thank you so much.
Okay, thank you. So, Doc,
We have two questions.
Thank you.
The first question is this medication that we are talking about, was it recently discovered? Even from way back,
and then the second question, is it each and every hospital under the Ministry of Health that has this medication, or there are specific hospitals
Okay, thank you
that
so much.
that have these medication?
So, so this medication is not something that every hospital will have, because it's supposed to be used, usually it's something that you're supposed to use by specialists, right? And unfortunately, so it's only in centers. We're only going to have it in centers that have neurologists. That will be UTH, Levy, Ndola Teaching Hospital, Quito Teaching Hospital. Those ones will be able to do that.
Okay.
So other centers some of them don't even have CT scans, and then even if some of them that don't have the actual specialists to help administer it in the way they're supposed to be administered. So we've had this medication for some time. Just that it's very expensive, right? If you had to buy it in Nectarplace on your own, for example, that's one of the drugs. It's like $900. So yeah. So that's why it's been there, but just people can't really afford it, right?
Yes. Okay.
But now that the sort of the Ministry of Health has sort of making it available now to some of these institutions where we're able to do that, that's where we'll be doing those such things. And then so maybe in future we may have more specialists in some of these other hospitals. Right now we just have very few people. Like for neurologists, we're only 14 of us at the moment in the country.
the whole country.
Yes, and we Zambian neurologists and so have only 14 at the moment, and probably that number may increase in the next couple of years. And the couple of is just the two of us, me and another neurologist in Quito.
So Copper Belt has two.
Copper Belt has two.
You and your colleague in Quito.
Yes. So it means right now, obviously, the other centers, lower centers do not have neurologists. But as we start training more doctors to become neurologists, and probably have a larger number. So we're looking at maybe like next couple of, because 8 years ago we didn't have Zambian neurologists. So it means at least we've sort of increased the number, and in future we should have more. So maybe in future we'll have these other centers also be able to perform some of these, take care of strokes and have stroke units, and maybe more specialized stroke care. But at the moment, it's only the centers that I mentioned. I think even those ones.
Okay.
Should be the ones that will be able to do these things for you.
Okay, nice, Doc. Let's see if we can pick 3 more, Oliver. Then we can allow the doctor to summarize, and then we can pack our bags and go. +260-212-617140. In case you have any contribution, comment, or just a question for the doctor. I think he has put it on record. We only have 14 neurologists in the country as we speak, and only those big centers, bigger hospitals like Ndola Teaching Hospital, UTH, Levy, among others, have such expertise. So it's not every other center. So in case you have any other question, you may come through on +260-212-617140, +260-212-617140. Maybe, Doc, even as we wait for more calls, you can take this time just to give us a bit of what I would call home remedy.
Okay.
Just before this particular patient has contact with a trained neurologist.
Yes.
As a caregiver, you notice this happen at home. What are the first things that you're supposed to do before before this patient comes in contact with the specialist?
Okay. So I did mention some of these before. Excuse me, sorry. So some of the first things, of course, is just to ensure that this patient doesn't, if they are fitting, then obviously they don't end up choking or whatever,
Yes.
because that will cause an aspiration pneumonia, which will eventually kill the patient. When you bring them to the hospital, it will be difficult for us to treat. Other things you'd want, of course, is to sit them up. Like I mentioned, pressures in the brain increase when you have a stroke, whether it's ischemic or hemorrhagic, because the skull, right? The brain sits in the skull, which protects it, and doesn't have space to accommodate other things. So when you have a bleed in there, it means that that's taking up space. So that's when I have increased pressure. They'll start vomiting and so on, which would cause risk of all these aspirations. So you want to nurse the patient at least a bit propped up. Huh? So it should be, the head should be higher than the rest of the body, so that at least you reduce pressures there, and also you reduce the risk of them aspirating. Other things you also want to do maybe would be, for those that I mentioned that are fitting, you can even lay them on the side, right? So to reduce the chances of them. And don't feed them when they just had a stroke. Don't feed them, because you don't know whether they have strength to swallow, or they have, because the weakness that you're seeing in the arms and legs is the same weakness that they may be having there on the throat.
Yes.
Yes. And also, what else? In fact, one of the other problems we've had in our hospitals is that even when we discuss these things, I know maybe sometimes the goodness with stroke units that we're trying to educate our bedside or caregivers and so on.
Bedside
on
as they are known.
Yes. So we're trying to educate them, because taking care of these clients is they're the ones who end up taking care of them. But what we've found is that sometimes, even though you explain some of the complications that they have, you find that they still, because people want to see, they feel like the food, even though you're feeding it through a tube, they feel like it's not really getting the patient. So they should trust, of course, what we explain to them, because we find that patients the caregivers still go ahead and feed them when you're not there, and you find this patient now develops these complications that you worry about. Another thing is also turning them. We want people to be turning, those who can't move on their own. You need to be turning them every couple of hours. Every 2 hours is what we recommend, because they develop these sores. Because bed sores. Because your bone is in one place, and you have soft. Your skin is soft and everything. So that they'll get these sores, and then they get infected, and makes it very hard to treat. So if you are not able to bring them immediately, then at least start taking care of them. Start telling them. Start trying to move their arms and legs. Because one other thing that will happen is that if you don't move those, they'll develop these clots. These clots could go into the heart and cause other problems, go into the heart, and then eventually end up in the lungs and cause other problems that will make it also cause death earlier than you'd have in just a stroke on its own. So we look out for all these complications. And of course, stick to the medication if the people that, because one of the reasons we're having so many strokes. Oh, another risk factor I forgot is HIV. HIV is one of the reasons we're having so many strokes. Most of our young people who have HIV now are stopping to take medication and end up coming to the hospital with strokes. So HIV is also an important risk factor for stroke. Yeah, so stick to your medication. Make sure you're doing what you're supposed to do. Exercise. We advise doing 150 minutes of some sort of physical exercise in a week. So it means you can divide it into 30 minutes a day for 5 days in a week, or 50 minutes. Moderate intensity, which would be brisk walking, if you're able. So jogging, we usually consider it like high intensity, right? So that one you just need like 75 minutes a week. But we also advise things for those that are healthy, because prevention is better than cure. Cure, we've already mentioned, you would have to give these drugs, and if you're a bit late, you may not get complete recovery. So that's what we advise, basically. This is a lifestyle disease, and we're getting it now because we've westernized our lifestyle. Wakati tu already afi, tu already kapenta na shani, stand up for already afi, pizza, shani. Those are the things that we want to be eating. So that's the reason why now we're having these problems, because now we have. Stroke was a disease of the older people. We know stroke is even more common in men and more common in black people, and that's the reason why this is an important topic to discuss here in Zambia, because it's a country of black people, and we're at risk of these things. So we need to take care of ourselves. Those are things we need to.
Thank you very much, Doc. A huge thank you to Dr. Mulenga Chilando, and for those insights. I think I've learned a lot personally, and I'm hopeful that my listeners have too. So remember, our listeners, stroke is a medical emergency, and the faster you act, the better. So to all our listeners, be informed, take care of your health, and obviously make sure that you follow medication just like the doctor has said. Make sure you do the right thing at the right time. So until we meet next time Saturday with another informative and interesting medical topic, this is where we come to an end. And I have to say thank you very much, Doctor, for sharing your that information with us. You've given us your valuable time just to be with us on the show today.
No, thank you so much for having me on the show. This is a talk that I've been wanting to have, trying to make sure that at least everyone also knows what's available for treatment of strokes, because this is a problem that is only getting worse now. We're having more and more strokes as time progresses. So thank you so much.
Okay. So on behalf of Dr. Mlenga Chilando, my name is Lamek Zulu, also known as Four Legs, saying God bless you. Continue enjoying our programming on Sun FM radio and TV. For now, I'm out until we meet next Saturday on Health Talk.
You are watching and listening to Sun FM TV on Channel 91 on Topstar.